What are the drug treatments for hair loss? There are various treatments in the form of supplements and remedies that aim to promote hair growth and prevent hair loss, such as hair shampoos, serum oils, biotin capsules, and platelet-rich plasma injections. They all have mixed consumer reviews. There is lack of clinical data on efficacy, and in a lot of cases, lack of transparency as to what other ingredients are in these supplements. So in the end, it comes down to two drugs licensed for hair loss treatment, which are Minoxidil and Finasteride, and they can be used in topical and oral forms, which means you can use them as a solution to spray into your hair or as a capsule to swallow. Increasingly, they are now used in combination in a single bottle, and depending on the company you buy them from, they come in different concentrations. But because there are a lot of different products in the hair market, which is a billion-dollar industry, and all claiming to completely restore your hair, you really do not want to be spending a fortune on hair products that might not work or work with partial results. Well, I cannot give you the best drug treatment for hair loss, as it depends on several factors such as side effects, genetics, and simply what works for one just might not work for another. But there have been studies looking at the most effective hair loss treatment for male pattern baldness, otherwise known as androgenetic alopecia, and it is not Minoxidil or Finasteride, which is what you see on the shelves or online. It is in fact oral Dutasteride. Oral Dutasteride, along with Finasteride, belong to the same class of 5-alpha reductase inhibitors, which are drugs used for shrinking enlarged prostate. They work to reduce hair loss by preventing conversion of testosterone to dihydrotestosterone known as DHT. Now, DHT will shrink your hair follicles, so the 5-alpha reductase inhibitors block the 5-alpha reductase enzyme to prevent that. Oral Dutasteride, taken at a dose of 0.5 milligrams per day, showed improvement in over 80% of patients, compared with just over 47% of patients taking Finasteride. However, while Finasteride 1 milligram dose is licensed for the treatment of hair loss, Dutasteride is an off-license drug for hair loss, as the safety profile still needs to be studied, such as risk of birth defects in women and hormonal imbalances. Oral Dutasteride has other serious side effects such as erectile dysfunction in men, low libido, breast enlargement, heart failure, high-grade prostate cancer, type 2 diabetes, kidney disease, depression. So you might want to consider the topical option, as the side effects are less serious, such as itchy scalp, a sensitive scalp, and redness. To get best results from oral Dutasteride or Finasteride, or even the topical version, it is advised that you combine with topical Minoxidil, and you will need to take them for at least 12 months, while you should notice significant improvement within 6 months. Minoxidil helps to reactivate the hair follicles, which would result in thin, fine hair. It will thicken your eyebrows, your facial hair, and existing hair. You can take other remedies such as hair shampoos or capsules alongside the drug treatments, but it's likely that their function will be to thicken the new and existing hair than to make it grow from nothing. Obviously, if you have tried all these treatments and they have not worked to your satisfaction, then having a hair transplant might be your next best option. Now, I hope you've enjoyed this video. Please feel free to share, like, and subscribe.